Chronic neck and back pain solutions. Back pain in particular is the #1 human symptom that people get. So it's also the most common phone call that we get in a chiropractic office, probably for physical therapy and acupuncture and your primary care office for sure, and massage and whatever it may be. Yoga, meditation is for back pain. Neck pain is close up on the list as well. So we're going to talk about chronic neck and back pain solutions. But #1, as we're getting into this, I want you to do an assessment first. Assess if you're having an emergency problem. The reason I'm talking about this is I've seen some emergencies come into my office which required medical attention. It was above and beyond the scope of what we handle in a chiropractic office. So do an assessment, and if you're having a flare-up, you want to assess if you're having severe arm or leg pain. If the arm or leg is weak, if you've lost feeling in your hands and feet, if there's no blood flow, so they're cold and white, you're not getting blood flow in your extremities, okay? That might be an emergency situation. Worst pain you've ever had, sharp pain, can't sleep, okay? Certainly, when it comes to the back, any change in bowel or bladder function, that is an emergency room scenario. That's 911, okay? Sometimes these can be other issues, but again, if you're having all of a sudden onset of back and leg pain and you're getting some bowel and bladder control problems, yeah, that's an emergency situation that requires medical attention, okay? If you're having severe back pain and you might think it's your lower back, but you have a history of kidney stones, or you're having nausea and you might be throwing up or a fever, keep in mind that could be a kidney stone, right? And I've seen that happen. I remember a phone call and a woman is talking on the phone about her husband. I could hear him moaning in the background because he was in terrible pain. I said, I think he needs some medical care here, and sure enough, it ended up being a kidney stone. Almost all of you watching this are not going to have an acute situation that I just talked about that requires medical attention, but just wanted to bring that to your scenario here. And as I get into the next several ideas on dealing with chronic neck and back pain, just keep in mind that this is not medical advice. Please talk to your doctor first before you engage in anything that's alternative, such as physical therapy, chiropractic massage, and so forth, okay? And maybe you need blood work and so forth, okay? So next on our list, if you have assessed yourself and you're beyond an emergency situation, then consider a chiropractic evaluation. Chiropractic evaluation. We can talk about chiropractic management for acute and chronic neck and back pain. We're going to start with history. So in a history, when we're really listening to somebody, most of the time the patient is giving us the roadmap. They're telling us exactly what's going on. I'll give you an example. Yesterday I had a patient. He had a flare-up he's in his 40s, neck pain, shoulder pain, back pain, okay? He also had some numbness and tingling down his arm. So it sounds pretty significant at the time, but then I found out that this was going on for 5 or 6 months, and that he's had flare-ups in the past, and it's responded well to conservative care. He's had prior chiropractic care, prior physical therapy for the shoulder. That also helped. He had an injury in the military, so that was part of the recent scenario, that it was flaring up of an old injury. He's had some off and on back pain through the years. So I realized he was in a flare-up mode. We talked it through, and sure enough, I knew what was going on. And we worked his shoulder. He actually had a shoulder issue. He was a little bit better before we left afterward, which was great. He had a separate neck issue, even though they were side by side. We had to figure that out. We realized he had an old shoulder injury and a neck injury. And then we figured out what was going on with his lower back. So the history really helped us out on telling us that he had an acute flare-up of some chronic problems. And with some gentle light force chiropractic techniques, we were able to start the process of helping him. I have a woman that came in last week. She's maybe 60, and she's had 2 years of neck stiffness and aches. But when I was peppering her with questions, we found out that she's had some existing neck trouble. She's also responded to conservative care, including chiropractic care in the past. She had traveled more, so traveling, she was on different beds, different pillows and so forth, and that could be irritating her neck. She was under more of a chronic stress situation, so she had more tension held in her neck as well, so Then the pieces fit, and we realized, okay, so we can probably help her as well. And 3 visits into it, she's doing better. Also recently, this is something we just want to keep in mind. This is, again, a curveball that came into me, is a woman that has been a patient of mine off and on for probably 15 years now. She is now 50, and she came in with acute back and leg pain. And she came in on crutches. Now, she's 50 and super fit, takes care of herself, good eater, works out all the time. And I was saying, kind of, well, you know, what happened here? And there wasn't anything significant. It wasn't like a slip or a fall, injury, and so forth. And she wasn't sick otherwise, but boy, she was not coming around. Somebody coming in crutches, I mean, that's pretty serious, right? So I thought, this isn't right. So she ended up going to having her primary care, set up an MRI. Sure enough, she had an infection. She had an infection in some muscles in her glute area, which was causing this sharp back and leg pain. It looked like a lower back problem, but it wasn't. It was this extremely rare infection. She got her appropriate medical care. She's at home. She's doing well. So sometimes you just really have to dig in and figure things out, and that's what we do in the office here as well, okay? So let's say somebody comes in and they've got typical neck and back issues. I just gave you a few people that have those typical scenarios, okay? Then you start going under the chiropractic management. And with our gentle adjustments, as we do in the office, and I've talked about this in prior shows, I have an instrument that stimulates joints. I do drop table that starts making light force adjustments to realign bones and soft tissues. We do soft tissue work in the office. I have a cold laser, a non-thermal laser that I work on some people. I've talked about that in prior shows. We also have a new magnet table that you can look up online as well. It's called, it's a React table, reactinnovations.com. And we also use that magnet table for pelvic floor rehabilitation for urinary incontinence. And you can look up that technology on pelvicwave.com. And that's a table that we have in our office as well. So we can use it for neuromusculoskeletal disorders anywhere in the body. And then we can also use it for pelvic floor. So that's something else that we have in the office. So a lot of the things that we have here for acute and chronic neck and back pain management are gentle and light force. Sure, we can do manual adjustments, but a lot of people don't want to have those manual adjustments. So we can have good success with those problems by doing our gentle light force chiropractic techniques. One of the things I want to touch on is giving people a diagnosis. This is a very common diagnosis. And a woman that I had today was asking me what we thought was going on with her neck issue. She says, you know, the muscles are super tight and super tender. What's going on there? And I said, well, your muscles are involved, but your muscles are not the source of your 2 years of ongoing pain. This is not a muscle problem. The reason I say that is a muscle problem doesn't last that long typically unless there's some sort of significant rare muscle disorder. Muscle problems are when we go to the gym, we lift weights, we get sore, a few days later it's gone. That's a muscle problem. Most people's pains, aches, sharp pains, whatever it is, tightness and so forth, it's not muscle soreness. It's a deeper ache, it's sharper pain, it's something that feels different than post-workout soreness. So we know it's more than just a muscle problem. So in the neck region, I'll give people the tentative diagnosis of a disc problem or a joint problem. And in the lower back, I'll say you have disc irritation, okay? Most of the people do not need an MRI. So some people can have a disc herniation or a disc bulge or a disc prolapse, maybe not. And oftentimes, people come in and they have disc herniations and bulges and so forth, and they respond really well to conservative care, chiropractic, physical therapy, massage, acupuncture, whatever it might be, okay? So even if somebody has a diagnosed disc problem or not, I will say you have disc irritation. That's why you're crippled. That's why the pain's going down your leg. That's why you're having trouble sleeping or working out or working or whatever it is, okay? So if we're going to see this problem get better with chiropractic care, we're going to know that in a few weeks. If it's moving in the right direction, we continue. Okay? So those are tentative diagnoses that I give people. Disc irritation in the lower back and disc and joint irritation in the neck. And that's why it lasts more than just a couple of days. Okay? So that's the chiropractic evaluation and management portion of it. This next step here is so incredibly important. It's home exercises and ergonomics. Home exercises and ergonomics. And as you know, because we've done so many shows on spinal stretches and posture exercises and so forth, right? It's critical to stay on those exercises. It's like brushing your teeth. You brush your teeth every day, you floss every day, you're taking care of your teeth every day. We need to be doing the same with our spine. To get your changes, particularly in those chronic situations that are difficult to manage, doing your stretches, of course, we monitor that. We make sure you're doing the right stretches. You're not doing things that are irritating your condition. We want to make sure you're doing enough, but not too much at home, okay? That's the home exercises and stretches that we teach. Of course, they've been on this show many, many times, so you can refer back to them on videos on my YouTube page. We describe them on the website and so forth. Follow through on those stretches. This is where some people fall a little bit and slip up and don't get the results they're looking for because they're not doing the stretches enough and frequently. And secondly, when they start feeling better, they stop. So continue with those stretches as best you can. If anything is aggravating you, then pull back. Make sure you check in with me or your therapist or whoever you might be working with to see, are these exercises right for me? What alterations need to be making in these so they're the best scenario for you? I'm thinking of my 91-year-old man that came into me 2 months ago, and he had terrible back and leg pain. He had it for 3 years before coming in to see me. 2 years ago, he had some injections in his lower back. It didn't work, so he stuck with his pain. He didn't know what else to do. Luckily, friends of the family knew me, patients of mine. They said, go try the chiropractor. Now remember, he's 91 years old and he comes in like this, okay? And he's pretty unhappy because he's in pain. Pain was terrible in the morning, not as bad during the day, but terrible, okay? So he's doing like 50% better in 6 weeks. He's doing tremendous. But not only that, so we're helping his back and his leg pain, but we're also working on his posture. So he started like this, and now he's like this. When he first started, I'd have him pull back. He could get to about here. Now he can get to here. At 91, we can see the changes. He's walking more upright. He was walking like this with a cane. Now he's walking like this with a cane. And his whole demeanor is improving as well. He was super grumpy when he started. Now he's a lot happier. So that's by just a few exercises. He only has 3 stretches that I give him, but he's doing them several times in a day, and it's really making a difference. The second part of that is ergonomics. I just had another ergonomic situation now. A young man, he's maybe 55, coming to see me, runner, irritated his lower back, had to back off. He was doing some other things, ended up in my office because another patient sent him in. So we start working him over in the past couple of weeks. He's doing a ton better. He's 80% better now, and he's getting back slowly into running, but he said today, when I'm doing dishes at the kitchen sink, my back hurts more. I said, no problem, got you covered for this because this is in my Bocapi back. I've talked about it on this show. So I showed him that spread eagle posture, where you spread the feet far apart like this so you're closer to the countertop, right? So instead of being up like this and bending forward and irritating the back, you open the legs up like this, and now you're lower down and you don't have to bend at the waist any longer. So instead of this, he's lower down like this. And he tried it and says, no problem, I will give that a go. I can see where that's going to be valuable. That's what I mean about the ergonomics. Just recently on this show, we did shows on laundry and back pain. We did shows on window air conditioners and back pain. We did a show on water bottles and lifting cases of water at the grocery store. So these are the ergonomic changes that we can implement to stop irritating the spine as time is going on. I've had companies hire me during the COVID crisis because everybody was stuck at home, sitting even more, bad workstations, sitting on soft chairs, and really getting beat up. So we started talking about ergonomics. Better workstations, but the key with that, and this is a key point that you all can take with you, is frequent breaks to get up and move, to get up and stretch. Doing the stretches and changing ergonomics at the same time. And that's going to help you recover as opposed to sitting all day long, not moving, and in a bad posture. That's going to be a problem as well. So follow through in the stretches. Set your phone to take a 30-second break every 30 minutes with the ergonomics, and that's going to help you a lot. The next thing, number 4 here, is this. This is important. I've said this many times in my office to patients. I'm just picking a number. It just makes it easy to say. Half of pain is pain. The other half of pain is patience. Having patience. You look at that 91-year-old that had 3 years of pain, and then he comes in to see me, and I said, I told him, I'm not making any promises. This might take some time. Let's go for it. Have some patience. Boom, we get into it. And sure enough, in a week, he's feeling a little bit better. He's like, okay, this is working. 3 weeks later, he's feeling even more better. So he has patience. He's still in the office now, a couple of months in. He's having patience. He's 50% better, not 100% better. Have patience that this is going to take time. It probably took you decades to get into the scenario that you are now with chronic neck and back pain. It's going to take time to get you out of that. And as I've said to people, if I could take care of everyone and remove their problem in one visit, I'd do it, and the line to see me would be out the door and down the street, right? So it's not quite that quick. We know when we sprain an ankle and go to the physical therapist, it's going to take some time. The same thing with chronic neck and back pain. If you go to my website, drscottfuller.com, you'll see some cases where it took 2 or 3 years of working with people before they could say, okay, my chronic lower back problem is way better now. Now I can get back to activity and so forth. And these people that just stuck with it because every week, every month, they noticed continuous improvement and they stayed patient. Be patient, and if you stick with it, if it's showing signs of improvement, stick with the plan and it's going to help you a lot. Okay, lastly, so you're doing all these different things here that I'm talking about. The last point here, number 5, is some unsung heroes when it comes to chronic neck and back pain. And these are things that can affect how much pain you have or how much pain relief you can have if you dig into them. And the first one is nutrition, cleaner nutrition. The worse the nutrition, the more systemic inflammation, the more chance that you're going to be firing off those pain nerve endings. You're going to have more chronic pain. So sometimes you have to look at nutrition. Some people need a little bit of a tweak. Some people need a complete makeover. So look at nutrition. If you're not getting where you want to be, maybe you need a nutrition change, nutrition makeover as I call it. The second is general physical exercise. So maybe spine stretches are helping you, but now you've got to get into exercise when it's been approved by your doctor, that you can get out and start walking or riding the bike or doing videos at home, whatever it might be, to increase movement of the body. I had a patient today who said, I want to get back to the gym. I really don't have time right now. I know that workouts would help me, but I just don't have it. He's 50 years old. I said, no problem. I said, what did you do in the past? He says, well, in the past, I used to go to the gym for about an hour. I said, great. And you don't have an hour right now, do you? He says, no. I said, so I could assess that he said, he was thinking, if I don't have an hour, I can't go. So I said, how about this? And I said, where do you work out? He says, well, in the complex where I live, there's a gym, and I would go in there. Perfect. I said, do you like walking on the treadmill? He says, yep. I said, go to the gym, walk on the treadmill, 15 minutes, you're done. Walk in, do it, leave. And I said, what that's going to do is going to start the process of you exercising, and it's also going to start setting up your schedule that I'm going to carve out the time for me, I'm going to get there, and I'm going to start moving my body. He's already good at doing his spine stretches because it's helping him. It's helping his chronic back problem. But now he needs to move his body so he can get to the next level of improvement. I said, 15 minutes, you're out. I said, do that for a few weeks. Then go to 20 minutes. And then maybe you do one day 20 minutes on the treadmill. The next day you'll start lifting some weights that you've done in the past, and so on and so forth. So it doesn't have to be the hour and a half to get the ball rolling, you see. General physical exercise will get you there. Next one is sleep. We've talked about sleep in the show before. If we're not resting, we're not repairing. We need the rest time to repair. Start carving that out. You might have to watch fewer programs at night. Set an alarm to go to bed. Rest is going to restore your body. Chronic stress, we've talked about that in the show. Sometimes reducing stress will reduce chronic inflammation and chronic pain. Seen it happen with many people. Dig in, get help, get programs, turn off the news, listen to better things. Reducing chronic stress will reduce that chronic pain scenario. Next is supplements. There are anti-inflammatory supplements that I talked about in here on the show. The same supplements that have now been shown by researchers to prevent COVID-19 are the same supplements that I recommend to try to decrease inflammation in the body. Omega-3 fish oil, B complex, antioxidants, vitamin D and K, vitamin C, magnesium, zinc, and so forth. These have been shown to decrease inflammation and may help some of you knock down your chronic neck and back problems. So, and lastly is water. So if somebody is slightly chronically dehydrated, that's going to have a chance of increasing inflammation and pain. look at your water intake, talk to your doctor if you're taking medications before you really start super hydrating. And again, if you're concerned about getting up more overnight to go to the bathroom, then make sure you front load the day. Start your day with water, drink most of your water in the morning and the afternoon, and then trickle it down in the evening, and that should take care of that. Here are some strategies. This is what we talk about in my office with my patients on dealing with chronic neck and back pain. I wish you the best. I'm Dr. Scott Fuller.